Chairman Hoven, Vice Chairman Udall, members of the committee, it's good to see you again. It's just been a couple of weeks ago. I think I was here, but no, I know I was. So Chairman Hoven, Vice Chairman Udall, members of the committee, for the record, my name is Dave Flute, Chairman of the Siston-Wahpeton Sioux Tribe. I'm pleased to testify in support of S465, the independent outside assessment of the Indian Health Service. And I appreciate the opportunity to be able to provide some oral testimony here today. First of all, we want to thank Senator Rounds for his leadership and being a champion for us in the Great Plains region, and not just listening to us, but hearing us, but more importantly for the Senator and for all of you great committee members here that you're taking action. And we appreciate that. You're not just listening and hearing us, but you're taking action. And we appreciate that because action is needed. And we support this bill. Chairman of the Siston-Wahpeton Sioux Tribe. I am the chairman of United Tribes of North Dakota. And I am a member of the Great Plains Tribal Chairman Association. And we do have a letter and a resolution from the Great Plains Tribal Chairman Association that fully supports Senator Rounds' efforts with S465. So we know that health care is a treaty right. And that treaty right was established for the cession of lands that we ceded for American immigrants over 150 years ago. We're coming upon the sesquicentennial of the Fort Laramie Treaty. My tribe just celebrated the sesquicentennial of our treaty, and we know that that's a treaty right. And the Great Plains Tribal Chairman Association, Great Plains Tribal Chairman Health Board, we feel and strongly feel that the Indian Health Service is failing us. They're failing to meet that treaty obligation. We are not getting the quality service that we need. We're not getting the transparency that we're asking for. We're not getting the financial accountability. And I do want to echo and reiterate Senator Rounds' comments that we appreciate the recognition of those treaty obligations by our congressional leadership to those treaty tribes in the Great Plains region. Transparency is important for us. When the Great Plains Tribal Chairman Health Board, Great Plains Tribal Chairman Health Associations, and the Chairman Associations request information, it would be beneficial to both the treaty tribes, to the Indian Health Service, if Indian Health Service would provide us that information without questioning us why we need that information, or that it is or is not going to help us in trying to find the solutions so that we can help our congressional leaders fix this problem. And we see that in Senate Bill 465, that this will be a good first step forward to try to figure out what the problems are. Why is there a high turnover rate? For the Siston-Wahpeton Sioux Tribe, we haven't had a permanent CEO at our local service unit for quite some time, 2-3 years now. The Aberdeen area hasn't seen a permanent area director there for Indian Health Service for a long, long time. And the lack of consistency rolls downhill. And with the lack of consistency at the regional level also contributes to the lack of consistency at the local level. And that even goes further into the service that we're not getting. An example of this, Chairman, if I could real quick, we have tribal members with heart conditions. We have tribal members with diabetes conditions, different types of health conditions. They go to the Indian Health Service and they're seeing a doctor. And in 3 months, they're seeing a different doctor and they're giving them a different medication. And our tribal members are just being tossed here and there with different types of medications and different types of diagnoses. And we have issues there where, as Senator Rounds said, we're talking about people's lives here and the health care. And in my tribe, that young girl was given cough syrup when she was coughing up blood. And it makes the hair on the back of my neck stand up. I apologize for being very passionate on this issue, but there is a very big problem there in the Great Plains region. We need to get it fixed. We support the senator, and we have doctors that need to be filled at the local service level, and IHS comes in and takes our monies, hospital and clinic monies. Those might not be tribal monies, but they're obligated to the tribes, H&C monies. For the Siston unit, $2.2 million was taken. From the Cheyenne River Sioux tribe, $4 million was taken with no consultation whatsoever, no communication. And because our tribal members that have worked in the profession of health for a long, long time, they're restricted to not say anything to their tribal leadership. And I'm not going to mention any names, but we have people, good tribal members working in our local service units that are telling the tribal leaders, we think H&C monies are going to be taken. I called Admiral Buchanan and I asked, are you taking our H&C monies? He wouldn't say anything. He wouldn't say yes or no. And that lack of transparency is damaging the relationships that we need to build with Indian Health Service so that we can fix the problems of healthcare for Indian country. And we see that when we don't get the data that we're asking for, we have to make our observations on the data that we do collect that is being given to us by our research. And when IHS isn't giving us that data, our observations are they're using this money to channel into other areas where they failed to, as you know, the senator said, without having a budget formula, without having a plan, and they're band-aiding this and they're taking money from our service units. We have people with meth addiction, we have people with depression, opioid use that are requesting mental health services, and they're being turned away. We have $2.2 million that you're going to funnel from other service units when you could have used that money. IHS could have used that money and sat with the tribe, looked at our tribe's needs. They need mental health counselors. They need to expand their service rooms so they can counsel these people. And we have people that it's hurting us. Meth is hurting us. It's taken dollars away from people that need prosthetics for diabetes. Real life examples, Senator, I could go on and on and on. I apologize for the passion I have with Indian Health Service, but it's a treaty obligation. We fully support our South Dakota Senator as we do the Senate Committee on Indian Affairs. Just want to thank you for your time, and I'd answer any questions you have. Thank you.